Good morning. My name is Dr. Petrikovsky. I'm professor of obstetrics and gynecology, and the views expressed in this video does not necessarily agree with the views of the institution I'm affiliated with. This video is about long-term sequelae of COVID-19. In many diseases, you think you're done with the disease, pretty much go on your way with normal life. It's not necessarily so with COVID-19 or other viral infections. And clearly, as we mentioned before, that there is increased incidence of stroke, of neurological sequelae, loss of smell, taste, aggressive behavior, sometimes suicidal behavior, depression, and those all long-term sequelae of COVID-19, as well as some other viruses and chronic diseases. So people should be aware of it. It takes time to recover. Recovery sometimes takes months. But what's more interesting regarding COVID-19, although it's relatively recent infection, is the alarming rate of pulmonary fibrosis in patients who suffered COVID-19. At this point, the risk of pulmonary fibrosis is more linked to the severity of the disease. Those patients who were admitted to the hospital, who were on ventilators, are more likely to experience not only strokes, but also pulmonary fibrosis. Pulmonary fibrosis, depending on the stage, is a very serious disease when people cannot breathe properly for a long period of time, if not forever. There's no adequate treatment of pulmonary fibrosis, and at this particular point, people who suffered severe COVID infection are likely to develop it. People who suffered asymptomatic or light infection also may develop it. There is no strict recommendation on how to test for it. So you should pray that it's not your case. But clearly, some long CT scans on the patient who experience COVID-19 infection in various degrees, including what's important, asymptomatic infection, may later develop pulmonary fibrosis, have so-called opaque lungs on CT scans and sometimes chest x-rays. So that's something that the doctors and patient should be watching for. Thank you.